السلام عليكم magacayga waxa la yiraahdaa Misbil Faarax Xaaji Salaad waxa aan ka tirsanahay maaragtay Soomaalida ku nool Twin Cities-ka magaaladan maaragtay iyo waaxigeeda Twin Cities-ka waxa waaye Minneapolis iyo St. Paul caawa waxaan wadnaa barnaamij aan ku casunnay dhalinyarada ku nool Twin Cities-ka iyo waaxigooda oo ay ka hadli doonaan dhibaatada ay dareemayaan iyo caqabadaha soo food saara marka ay dhalinyarada maaragtay ay yihiin dhalinyaro wadankan ku koray ama ku dhashay ay yihiin oo maaragtay wadankiina maaragtay caqabadihiisina dhinac ka haysto isfahan la'aanta jaaliyadii iyo waalidkiina uu dhinac ka haysto marka waxay isu qaybiyeen saddex maaragtay group bay isu qaybiyeen qayb waxay u doodaysaa inay yihiin dawladda ama maaragtay gobolka bay u doodaysaa inay yihiin qaybna waxay u doodayaan inay dhalintii yihiin qaybna waxay u doodi doonaan inay yihiin maxaa la dhahaayeen jaaliyadii Soomaaliyeed inay yihiin marka waxaan rajaynayaa in aad dhageysataan doodooda hadda xataa aadan fahmi karin oo waxaan uu maaragtay uu kugu adag yahay Ingiriiska fadlan isku day inaad heshid qof ku tarjumo ciyaalkan waxa ay maaragtay soo jeedinayaan waa ilma aad u caqli badan waa dhalin maaragtay mustaqbalka bari u bixeenina waaye bulshana hadii u baxoodii uu maaragtay dhado oo biyo heli waayo uu kori waayo wajiba yani waa wajigeeni wajiba lihintum bari ma haysano dad namatala ama maaragtay ama mas'uul naga noqdo ma haysana anigu waan duqoobaya idinkoo duqoobaysaan marka yaa mas'uul naga noqon doona marka barnaamijkan caawa waxa naga caawiyay ama maaragtay naga tabarucaad naga siiyay Ramsey County Public Health Department marka bal daawasho wacan.
Assalamu alaikum. Good afternoon, everyone. My name's Ayan, and I'm excited to welcome you to today's debate. Let me ask you something. How many of you have ever worried about the challenges young people face today? Maybe it's mental health struggles or bullying or even things like drug use. Big stuff, right? And the real question is, who's best suited to tackle these challenges? Youth themselves, communities, or the government? Now don't worry, we're not going to solve all the world's problems today, but we are going to hear some really smart, passionate ideas from 3 different perspectives. First, the youth team. These are the people actually living it day to day. They see the struggles, the pressures, the social media chaos, and yes, even the stress about trying to finish homework on time. They'll share their ideas about how young people can help lead prevention in ways adults might not even think of. Next up, the community team. Communities are where trust lives. They know the families, the schools, the neighbors, and sometimes even your habitat who notices when something's off. They have experience, culture, and wisdom that can really make prevention stick. And then we have the government team. They bring the resources, the organization, and the long-term support that can take good ideas and help them reach more people and last longer than a week, unlike some people's New Year's resolutions. Here's how today's debate works. Each team will start with their opening statements, sharing their main ideas. After each statement, the other teams get to ask questions in a cross-examination. That's when the real sparks can fly, and we dig into the reasoning behind these ideas. And finally, if we have time, the audience, you, will get a turn to ask questions and share your thoughts. Because let's be honest, prevention isn't just about youth or communities or government. It's about all of us. The goal today is simple. Listen carefully, think critically, and maybe even learn something new. And who knows, you might leave with a few ideas about how you can make a difference too. So get ready, stay curious, and enjoy the debate. Thank you all for being here, and let's kick things off with the first opening statement.
Assalamu alaikum, everyone. My name is Holland, and I'm here to speak for the youth, for people like me, my friends, and my classmates. We're growing up in a world where mental health struggles, violence, and substance are real problems. We see it in our schools, in our homes, and sometimes even in ourselves. We see it But too often, adults talk about us without actually listening to us. We hear things like, kids don't know how to cope, or they're always on their phones. But what we really need is for someone to ask us what's going on in our lives and actually care for our answer. We believe youth should be at the center of prevention. That means we should help make decisions about how to stop these problems before they start. We know what's happening in our lives. We know what pressures we face. We have ideas. We just need people to take us seriously. When youth are ignored, preventions become guesswork. But when youth are included, preventions become powerful.
We're the ones dealing with peer pressure, bullying, anxiety, and depression. We're the ones who see friends struggle with drugs or violence. A study from the University of Minnesota found that many teens, especially from immigrant families, feel stressed, isolated, and afraid to ask for help because of cultural stigmas. If we're the ones being affected, we should help lead the solutions. Youth-led programs work. In Seattle, the Family Safety Task Force runs programs where youth lead workshops, share their stories, and support each other. These programs help young people feel stronger and more connected. In Somalia, the United Nations Youth Engagement and Empowerment Program trains youth to lead peace projects and prevents violence. These aren't just nice ideas, they're real programs that are changing lives. When youth lead, we build trust, we speak the same language as our peers, we know what works and what doesn't, and we're not afraid to try new things like art, religion, and social media to spread awareness and support. Leaving youth out doesn't work. When adults make decisions without asking us, these programs often don't work. A report from the African Youth Commission said that many mental health programs that didn't use youth voices failed because they didn't ask what we needed. They didn't speak our language. If we're not a part of the plan won't work. We're not saying adults don't care. We're saying let us help, let us lead, because we're already doing it in our schools, online, and in our communities. To measure the impact of youth-led prevention programs, we can look at both numbers and stories. For example, we could track how many youth participate, how many schools or communities are involved, and how often youth report feeling supported and less stressed over time. We could also collect feedback from participants and community members to see what's working and what's not. Real impact isn't just about stats, it's about seeing more young people feel confident, supported, and heard.
So here's what we're asking. To our communities, please listen to us. Don't just tell us what to do. Ask us what we think. Let us be a part of the conversations at home, at school, and in our community meetings. We want to work with you, not against you. To the government, give us a seat at the table. Fund youth-led programs. Include us in policy makings. Don't just create rules. Let us create rules with you. We're ready to help shape the future. And other youth, speak up. Your voices matter. Your stories matter. You don't have to wait to be older to make a difference. You can lead now. You can help someone now. You can change things. We're not just the future. We're the present, and we're ready to lead.
You said the government moves too slowly, but don't you think policies and laws are what will help protect and fund programs over time?
Yes, policies help, but youth-lead programs can build stability by partnering with schools, community centers, and local leaders who can keep work going.
Many youth-led groups are volunteer-based. How do you plan to keep these?
Yes, policies help, but youth-led programs can build stability too by partnering with schools and local community centers and local leaders who can keep the work going.
Many youth-led groups are volunteer-based. How do you plan to keep these programs running long-term if students graduate, move, or lose motivation?
We can train younger generations to take up those roles once the students that are now volunteering grow up and move on.
Would you agree that the government plays a necessary role in making sure youth-led ideas grow into national programs that help more people?
Absolutely. Youth lead the ideas and the government helps scale them up so they reach more communities.
You also said that youth should be at the center of prevention. What makes youth better equipped to lead these programs than professionals who have years of experience in mental health, education, or policy?
Yes, professionals bring knowledge, but youth brings lived experiences. And when we work together and the program becomes stronger, and it actually makes it more real.
Assalamu alaikum everyone, my name is Nemo and I'm here to speak for our communities, the families, neighbors, and leaders who shape our everyday lives. When we talk about preventing things like mental health struggles, violence, and drug use, we believe the best place to start is with the people who know the community best. Communities are where trust lives, they're where kids grow up, and where parents teach values, and where people look out for each other. It's the auntie who notices a child acting differently. It's the neighbor who checks in when something feels off. These everyday moments are where prevention begins. If we want real change, we need to make sure our communities are leading the way, not just being told what to do, because when solutions come from inside the community, they're more likely to stick, to grow, and to heal.
Communities understand their own needs. Every community is different. What works in one place might not work in another. That's why prevention needs to be led by people who live there. In many cultures, mental health is misunderstood. People might use words like walan or weak, and that makes it hard for youth to ask for help. But when community leaders like elders, faith leaders, and parents speak up, things start to change. For example, in Somali and East African communities, talking about mental health used to be taboo. But now, more local leaders are starting conversations in mosques, schools, and homes. That's how stigma breaks, through trust and understanding. Programs like Isroon's Drug Abuse Prevention Initiative in Minnesota work because they're built by and for the community. They use mentors, family support, and cultural education to help youth avoid drugs and violence. These programs don't just give out facts, they build relationships. They understand the culture, the language, and even the values of the people they serve. When youth see familiar faces leading programs, people who look like them, speak their language, and understand their background, they're more likely to listen, open up, and get involved. Sometimes government or outside groups bring in programs that don't fit the community. They use words people don't understand or ignore cultural values. Even if the program is well funded, it won't work if people don't trust it. That's why it's so important to let communities lead. When people feel respected, they're more likely to listen, learn, and grow. Community-led prevention isn't just about being local, it's about being real.
So here's what we're asking. To the youth, we need your energy, we need your ideas, and we need your leadership. But we also need you to work with your families. Sorry. To the government, support us but don't speak over us. Help us build programs that fit our culture and values. Fund community-led efforts. Include us in the planning, not just reports. And to our communities, let's keep talking, keep learning, and keep supporting each other. Prevention starts with us. It starts in our homes, our place of worship, our school, and our streets. We are not just part of the solution, we are the solution, and let us lead.
Community programs rely a lot on trust, which takes years to build. But what happens when a problem is urgent, like a sudden rise in violence or mental health crisis?
When a crisis happens, trusted community leaders can respond much more quickly than the government can, and they know who's affected and how to actually reach them.
You've talked about culture and values, but sometimes those values might discourage youth from asking for help, like around mental health. How do you balance respecting culture while still making sure kids get their support?
Well, we work with elders, parents, and faith leaders to shift harmful beliefs while keeping the parts of culture that protect and uplift the youth.
Many programs focus on mentorship, but what about kids dealing with serious crises like domestic violence or drug addiction?
Community program partner with crisis centers and health services to make sure youth in serious danger get the help they need really fast.
Some problems like mental health stigma can deeply be rooted in culture. How do you know community-led programs will change minds and not just maintain the same status quo?
Because change is already happening. When community leaders speak out, host workshops, and share their stories, that's how stigma starts to break.
Assalamu alaikum everyone. My name is Ahmed and I'm here to speak for the role of government in prevention. We know that youth and community groups are powerful, but they can't do everything alone. That's where the government comes in. They're not here to take over. They're here to help organize, fund, and grow the ideas of the youth and communities. They want to make sure that prevention efforts like stopping violence, helping with mental health, and reducing drug use are fair, strong, and long-lasting. We believe that when government work with young people and communities not above them, they can help build programs that actually make a difference. Prevention isn't just about rules, it's about relationships, and they're ready to build those together.
Assalamu alaikum. I'm Ayub, and this is Core Arguments. Youth and community groups often have great ideas, but they need resources to make them happen. Government can provide funding, training, and tools to help those programs grow. For example, Somali's Ministry of Women and Human Rights Development works with the UN to support mental health and violence prevention programs across the country. These programs include education, counseling, and support for survivors, and they're also backed by national policy. Prevention works best with youth, communities, and organizations that work together. Government can help build those partnerships. The Den Wadag initiative, supported by the International Organization for Migration, combines mental health support with job training and community healing. It shows how government can help different groups work together as a team, not just by giving money, but helping those people collaborate. Sometimes, community programs don't last because they don't have enough support. Government can help make sure good ideas don't disappear by creating policies and laws. Government can help protect and grow prevention efforts for years to come. That means youth-led and community-led programs don't just survive, they thrive. When government listens, funds, and follows through, prevention becomes more than just a project. It becomes a promise.
So here's what we're asking. To the youth, keep leading, keep speaking up. We see your ideas and we want to help you grow them. The communities, keep guiding. Your wisdom matters. We want to support your leadership, not replace it. And to government leaders, listen, fund, and work with everyone. Don't just make rules, make relationships. Don't just launch programs, make sure they last. Prevention is not just about today. It's about building a better future, and the government is ready to help make that happen together. Thank you.
You mentioned the government ensures programs are fair and consistent, but different communities have different needs. How can a national plan truly represent everyone without becoming a one-size-fits-all?
Governments can help create flexible policies that set standards but leave room for communities to shape ways for programs to fit their culture and needs.
A lot of people in immigrant and refugee communities don't trust government systems because of past experiences or language barriers. What will your team do to build that trust and make sure people actually use your programs?
We would partner with trusted community leaders. We'd offer materials in multiple languages and hire staff who reflect the communities that we serve.
The government often partners with large national organizations instead of smaller community groups. How will you make sure smaller, culturally specific groups get the same funding and attention?
Governments are working to change that by creating grant programs just for grassroots and culturally specific organizations with simpler applications and local support.
If our communities already have a working prevention system built on trust, wouldn't having too much government involvement risk slowing them down or changing what makes them effective?
That's why they don't want to take over. They want to help support what's already working by providing resources without changing the heart of the program.
All right, this is the final closing statement. All right, everyone. As we come to the end of this debate, we want to pause and reflect on what we've heard, not just as teams, but as people who care deeply about our communities, our futures, and about each other. Each team today has brought something very powerful to the table. The youth team reminded us that young people aren't just affected by mental health struggles, violence, and substance abuse. We're often the first to see them, we're often the first to feel them, and the first to respond to them. We bring lived experience, creativity, and courage. We know what's happening in our schools, in our friendships, and in our minds. And we're not waiting to be older to make a difference. We're already leading. The community team showed us that trust, culture, and relationships are the foundation of real change. Communities now know their own needs, and they've been quietly doing prevention work for years through mentorship, family support, and cultural wisdom. When communities lead, people feel safe enough to speak up. They feel safe enough to learn, and they also feel safe enough to heal. The government team reminded us that structure, funding, and long-term support are essential. The government can help good ideas go into national movements, and it can protect programs with policy. They can connect groups across regions and make sure prevention efforts don't disappear. when volunteers move on or funding runs out. So instead of asking, who's right, let's ask, how do we work together? Because the truth is, we need all three. We need youth at the center, because we bring energy, honesty, and first-hand experience. Then, we need communities leading, because they bring trust, culture, and connections. And we need government support, because it brings resources, protection, and reach. Prevention isn't just a one-size-fits-all. It's a team effort. It's a circle, not a ladder. And when we listen to each other, when we respect each other, and when we build together, we can create something stronger than just any one group could do alone. So let's stop choosing sides. Let's start choosing each other. Because youth-centered, community-led, and government-supported prevention isn't just a good idea, it's the only feasible way forward. Thank you.
Do you guys, the audience, have any questions for us?
So what I'm hearing is that you want youth representation in many organization or leadership, right? So there are already many Somali-led nonprofit organizations that are saying we're serving youth. So don't you think when they apply in a grant or putting an application, it should be some sort of a mandatory that they have some sort of a percentage of youth in their board? Like, women organization, you have to have a certain women on your board members. Like, what do you think, what would be ideal number or ideal percentage those organizations, should have, like, as board members?
I think the youth should have over 80% for taking the lead. They can't do it alone since they're still minors, still young. They still need the adults and the supports.
It's not just the youth we're asking for our communities as well. So even though there are some youth organizations here, I think there should be way more involvement from the community. Because for the most part, we kind of just we see the organizations, but we either don't join or we don't listen to what they have to say. So I think it doesn't just take the youth; it takes the community members as well to actually join in.
By working as a community, or how do I say this? Do you guys know how to work as a community together?
The best way to work as a community is by sharing our ideas. I reckon there's a bunch of youth that have amazing ideas, but they don't speak up. If they don't speak up, no change can happen. Any other questions?
Okay. I think they could work together by just overall combining their strengths. Youth, they bring the ideas, communities could bring the trust, and just the government would bring the resources. Yeah.
As Somali youth today, what problems do you see that need kind of urgent attention from both the community and the government? So what's ailing you guys? What do you guys need help with? What do you guys see as urgent amongst your peers?
I think the most urgent topic that we have to talk about is the mental health. Because of the mental health, the stuff that the young people are going through, it's leading them to the violence and to the substance abuse.
I think we should definitely tackle the drug abuse in this neighborhood. If you even walk outside this masjid, you're going to see a whole line of people actively doing drugs. And I feel like if the youth are exposed to drugs early in their life, they're more likely to take it and see it as cool. So I think the community should take a very harsh stand on getting rid of drugs in our area.
Youth in the mental health is the foundation of it, and for all the prevention efforts. So if their mental health is bad or isn't well, it'll fall apart, make everything else fall apart. Yeah.
Especially in America and countries that are not in Somalia, I feel like drugs and stuff has been so normalized to the point where if you see a kid vaping, it's going to be they all do that. And most parents are not sure of what their kids are doing, which leads to their kids to be like loose and wild and do whatever they want. I feel like we should tackle that as a problem as well.
Even in our homes, right? I feel like the first sort of substance that I think kids are exposed to is shisha. I think shisha is a very big problem that Somalis are actively participating in, and I feel like it sets a bad precedent for the kids when they're growing up. Because if they're seeing their parents, they're seeing their aunties, they're seeing their uncles actively smoke shisha, they're more likely to think that smoking's okay.
Yeah, I think just like what he said, if things like shisha just become normalized, it'll just be like a stepping stone to, oh, if that's normalized, then I could do this, or I could move on to that. So I think just having, and that's part of the community aspect as well, having the community leaders set the tone for what is and isn't acceptable in your community, yeah.
Like, I know you guys bring up like a couple of issues like the shisha being normalized, especially amongst the Somali community. Do you guys think that your experience as diaspora and like the disconnect between your parents or people from back home and now are affecting how the community sees you guys and how serious people take you?
Yeah, I think that's really important that things, just in the beginning, if something isn't normalized like it isn't today, like with the shisha, people vaping and all that, I think as long as the community members and the community leaders set the tone for what isn't and isn't acceptable, what isn't and isn't normal, I think that we can get taken much more seriously since we're more strict on ourselves, and we'll be taken more seriously that way.
I think there is like definitely a big generation and cultural gap between parents and children, and like even like maybe if their kids don't speak the best Somali, like they might not understand their kids. They don't understand what their kids are going through when they go to school or throughout their day. So I think that gap in understanding leads to like them not understanding like maybe how big of an issue drug use is, and not understanding like how much they're like when they do smoke shisha, like maybe they don't understand like how that affects their kids to go smoke cigarettes and nicotine and pushes them towards that kind of stuff.
When you ask them in the clinic or the hospital, do you smoke? They'll say no, because they don't realize shisha is actually tobacco. So that is a lack of education, I think, in that sense, because they can't, they put smoking in one category and then tobacco in another category. I don't think that they connected those two things, and I tell them, no, that's smoking too. And then they say, no, it's apple. No, it's a tobacco. Like they don't actually know what that is.
Awareness that our community, the Somali community, the stigma of the stereotype and stigmatization of the people, like within our community, how you think that will be, solve it? Is it more involvement, or how they gonna do it?
I think in the Somali community, most people, when they see someone out in the streets, or if they see someone that's slightly like not there in their head, they'd be like, oh, we walanta or walaya iski ilalia. Like, instead of saying that, we could help them, like support them from what they're doing. Be like, that's not okay. But instead, as the Somali, like the stigma is, like the Somalis, we just push them further into what they're doing. We don't help them as much as they need.
I feel like there's a lot of people when they're going through such thing as depression, people bring shame to them with that, and instead of, we do this thing where we don't acknowledge people's struggles, instead we shame them for that and we blame them, like we say, oh, this person's like ill, instead of actually trying to help them, we just shame them, which make them feel like, it makes them insecure to even ask for help, which just, as she said, it does push them further into their own problems.
Do you know how the government can help with like getting the people who use like drugs, like help them?
I feel like the government can help limit drug abuse by putting a limitation on how much it gets sold and how accessible it is. Right now, I feel like a lot of drugs are being legalized and normalized, which it really increases how people intake it. Because if you just normalize and make it easy accessible for people to reach, then I feel like it just increases the problem. So putting like a limitation on how accessible it could be is one way the government can help.
person that talked about mental health earlier, just about the stigma around it. I feel like if we could just talk about more, educate more, like our wonderful audience member said, just about educating the people for it. Like there could be an app on your phone just to talk to a therapist very quickly, and just making it feel normal, and more about normalizing it through our community leaders and having and creating more tools through our government, and just to help normalize it more and make it easier to just ask for help in general.
What kind of advice would you guys give to like people who use drugs or like tobacco?
I would say they should definitely seek help. There are, like, especially with like nicotine, there are other solutions other than smoking. There's something called like Nicorette gum that helps a lot of people get off of smoking. I work at Walgreens and I see a lot of people buying Nicorette gum. And when I asked them, why do you guys take this? They said that it's a better alternative than to smoking. It relieves them from their addictiveness to nicotine, but in like a less harmful way. So there's definitely solutions out there. It is that people don't know about those solutions and they don't seek the help to actually find those solutions.
So vaping is not a good solution to trying to stop smoking. It is so much more harmful with the metals and stuff that's in there.
I feel like one important advice I would give to people who struggle with drug abuse is seek a help that's more long-term. Like drugs is temporary. I feel like you should seek something that would help you in the long term. Drugs, it runs out and you would just feel worse than you would felt before, and like it just makes your health, well, it has a bad turn on your health. And I would say use like a healthier option that would help you better, like spiritually, emotionally, and physically.
I think you guys have like all established that Somali people are very avoidant when it comes to the issues that are plaguing our communities, but it's like easy to say, to be like, we're gonna do this and we're gonna fix this problem, fix that problem, but how do you guys plan, or what would you guys do to create the space between the elders and us, or community leaders and us, to kind of address the issues? And like, how would you guys go about that?
First, I'd say we need to educate the elders, because it's different than how it is in Somalia or how they think it is. I feel like they don't see it the way us youth do, and they're just like, oh, they're saying wallahi, it's okay, I'll say wallahis, do that.
Oh yeah, I feel like that could be another opportunity for the government to help the community by maybe creating like mentorship circles, or like maybe a cultural night for elders to better connect with the youth.
Like the youth try to talk about their problems, it's seen as like talking back and like disrespectful, and that like makes it hard for the youth to actually stand up and speak for themselves. And also, like, I feel like a lot of parents think that like therapy is a bad thing. It's not a bad thing to try to speak to someone and get the help that you need.
There's more questions.
Okay.
Yeah.
Can I like just tell you something about that culture thing later on about therapy?
It's like, have you ever tried to use all the resources that you have, like government and non-government organization, worship places, for example, coming together all as a teamwork? Have you ever considered this?
Like what we said earlier for the Denwedig initiative in Somalia, where the people, they combined mental health support with job training and local prevention programs in Minnesota as well, that can get government funding while being led by community groups.
Argument that I'm going to raise is that government soon will say, we're cutting all the budgets, right? There will no be funding at some point. What would you advise to your community and parents, neighbors? What would you advise them and say, these are the responsibilities you have, this is what you need to do? What are key points?
I feel like it's more about educating them, so as soon as they can really properly realize that of the importance of mental health and how mental health affects the youth and just the severity of it, I think that's when they'll really start to care much more about it and be willing to give more resources to it in the community if and when the government cuts off funding.
So, me personally, I really think that the household that you grew up really shapes the person you become. And to me personally, I really think that everything starts in the household. And I think to Somali parents, I think you guys should really, really consider the household that you're raising your kids in, because whatever you do, your kids take after. Like my little brother, he copies everything my dad does. And I really feel like if you're trying to push back against your son asking for help of something, that if he feels depressed and you're pushing back against him, you're just causing him more pain, and he's just gonna rip away from you even more. And then later on, you're just gonna blame him. And I really feel like most parents should consider the fact that every kid is different and times have changed and other things impact kids that you guys don't usually think about. And like calling a kid to say wallahi, it's like you guys don't think, it's a big insult, because kids, if you guys, when you guys first brought them to America, for example, if you guys would have went the route of talking to them in your native tongue, that would have been different. But you guys didn't. You guys slowly, I'm not blaming the parents, and I'm not trying to diss anybody, but you guys are the main reason that kids are pulling away from their heritage. And then later on, they get blamed for it. So I'm saying think about your actions, because those cause a lot to the youth, and they carry those burdens to the next generations.
عليكم waxaa caawa halkan ku kulmay dhalinyaro kamid ah dhalinyarada Soomaaliyeed ee ku nool Twin Cities-ka Minneapolis iyo St. Paul agagaarkeeda waxay lahaayeen maxaa la dhahaayeen dood wadaag oo ay ku soo bandhigeen baahidooda iyo maaragtay caqabadaha ay maalin walba la kulmaan iyagoo ah dhalinyaro ku nool wadan qurba ah ku dhashay wadan qurba ah maxaa la dhahaayeen dhibaato ay ka haysato in dhaqankii maaragtay keenii Soomaaliga ahaa iyo kii maxaa la dhahaayeen Mareykanka in ay isku dheelitiraan haddana caqabado kala haysato ay yihiin caqabadihii in maaragtay waxyaalo badan oo aan fiicnayn ay iyagu maalin walba arkayaan, sida daroogadii oo kala maaragtay jidadka lagu hayaa ama ciyaaladii iskuulka la dhiganaya isticmaalaya ama ku dhex jira. waxaa kaloo jirta maaragtay qofka markuu xaaladaha adag cunsurinimada ay ka mid tahay ama cadaadiska ka imaada markaadan ahayn qof wadankii u dhashay, waxaa jira mental health, yani xagga dhimirka qofku uu maaragtay ilkaambinaya ama uu murugoonaya. xaaladahaas xaggaas maaragtay dhimirkana waa iska jiraan oo anaga qofka waxa u naqaanaa ama waali ama inuu fayo yahay. inta u dhaxayso waxa jirta cadaadiska nolosha, stress baa la dhahaa, qofku la kulmi karaa ka laftirkiisa wuxuu hadhow isku bedeli karaa depression. macnaha waa qofku markuu inuu xoogaa isla hadlo ama uu bilaabo in maaragtay iskaliyeeyo. marka waxaa jira daaweyn, waxay leeyihiin waalidiinteedni ma fahansana in maaragtay waxaan daaweynta ama therapy in waxaa jira dadka lala hadlo ma fahansana. midaadii kale barnaamijyada magaalada ka jira ama gobolka ka jira dadkeeni maaragtay bulsho ahaan ama jaalid ahaan ma fahansanin, lama soconin. waalidiinta ma raadiyaan maxaa ilmaheeni ay ka faa'iideysan karaan, ma raadinayaan oo waxaysan fahansaneenba systemkii ama maaragtay sidoo qaab dhismeedka wadankii ma fahansanin. marka iyaga maanta doodoodii waxay ay ku soo jeediyeen luqadda Ingiriiska ah. marka waxaan rabnay inaan maaragtay soo koobno oo niraahno ciyaalkii waxay ka sheeganayaan wadankii baa cadaadis ka jira oo maaragtay waa dad waxaan nahay dad laga fara badan yahay. marka iyo waalidiinteeni oo ahayn dad ilmihii dhexgalaya bulshadii dhexgalaya ilmihii u raadinaya barnaamijyada ay u baahnaayeen iyo maaragtay jaaliyadii oo iyaguna ku baraarugsanayn dhibaatadana haysata maanta oo aanan u garaabaynin qofkii xanuunsan oo haysa cudurrada dhimirka oo hayo aan u garaabaynin marka qofka wuxuu ku qasbaysaa inuu raadsado daroogo oo asaga isdaweeyo maadaama uu ka hortag jirin marka wuxuu ahaa maaragtay barnaamij aad u fiican oo caawa aan dareennay ilmaha inay u baahnaayeen in la dhageysto oo waxay leeyihiin miiskii waan ka maqannahay markii xataa barnaamijyada go-aanna looga gaarayo kuma jirno maxaa la dhahaayeen go-aan gaarista kuma jirno ma rabno in annaga go-aan nooloo gaaro in aan go-aanka isla gaarnaan rabnaa marka waxay rabaan in ay ka mid noqdaan dadka go-aamada u sameeya barnaamijyada ciyaalka ama barnaamijyada dhalinyarada marka waxay rabaan inay dadkii soo dhex galaan oo waxay raadinayaan wadadii ay kusoo dhexgeli lahaayeen marka adiga jaaliyada ka tirsan ama adiga oo ah waalid ama adiga oo ah deris ama adiga oo ah eedo abti adeer waxaa laydinka rabaa inaad maaragtay ku baraarugtaan dhibaatadana haysato iyo cabashada ay tirsanayaan maaragtay dhalinteena oo aan fahano baahidooda marka salaamu calaykum intaasaan kusoo gabagabaynaya